switching topics, it's a distressing, sometimes embarrassing problem that can have a huge impact on your quality of life, but goes underreported to most doctors. Ogden Clinic's Dr. Brad Stevenson says there is a new therapy that can help those suffering from incontinence. It's good to see you. Thanks for being here.
Thanks.
Of all the medical topics to talk about, this is my favorite.
Yeah, it's your typical dinner time conversation.
Absolutely.
Right?
Here it is. How common is this problem, though, really?
It's a lot more common than people think. A lot of times women think I'm the only one and they're embarrassed to talk about it. In the United States, it's 1 in 7 women suffer from overactive bladder.
1 in 7?
Yeah, that's more common than diabetes, more common than asthma. It's a very common problem.
So as we talk about it being underreported in the doctor's office, is that strictly because of embarrassment?
That's the biggest issue, is that they just don't feel comfortable talking about it.
So let's talk.
Understandable.
Well, we're talking about it today,
Yeah,
and I feel perfectly comfortable. Here we are.
Good.
Let's talk about treatments then for bladder control. What are the options that are out there?
So most people have seen the ads about gotta go type medications to kind of calm the bladder down. And that's the first line treatment, is to see if those work. They've done studies though, and within a year of starting those medications, 80% of patients have dropped off of them, either because they don't work or they don't like the side effects. And so then they just think that it's a problem they have to live with. But there are options after medication.
Such as what?
So there's an option called Interstim Therapy. It's a nerve stimulator. So we're all familiar with pacemakers.
Right.
And kind of keep the heart beating at the right pace. This is kind of like a pacemaker for the bladder. You can think of it that way.
Okay.
So what it does, the problem with overactive bladder is just like any other part of your body, the bladder has nerves that go to it that send signals to the brain, and the brain sends signals back to the bladder. Women with overactive bladder, the bladder sends too many signals to the brain.
Okay.
So you go to the bathroom 10 minutes later, you feel like you've got to go again, you're waking up all night to go, and that's because there's a problem. It's just
with those
nerves, yeah, they're just sending a signal too often. And what this pacemaker for the bladder, so you can think of, it sends a little electrical signal to that nerve and kind of resets that flow of the signal.
Who's a good candidate for this procedure?
A good candidate is someone who is bothered by their symptoms.
Okay.
A lot of women say that their bladders control their lives. They can't go on road trips, they can't go to movies, they've got to know where a bathroom is at all places.
Right, they would just like to jump on the tramp with their kids.
Right.
And be dry at the end of the day.
Yeah, so anyone who's bothered by it and has tried the other therapies, the medication, and it just hasn't worked for them.
Okay, how can we get in touch with you then to set up an appointment if we fit into that category?
You can find us at our website at ogdenclinic.com.
All right, see, that wasn't hard. Was that hard?
That was easy.
We did it. Dr. Stevenson made it comfortable too. We'll post a link to his clinic information on our website if you want to set up that appointment and see if you're a good candidate for this procedure. And just nice to know there are options out there. Thank you for stopping by.
Thank you.
We'll be right back.